presentation. And I'm going to do the slideshow so everybody sees it. Oops. All right. So let me go all the way to the front. You're getting a great view of what we're going to do. Here we go. I have plenty of stuff, information for you, but it's interesting that it's becoming so big. All right, so pretty much in order for everybody to know what we're going to talk about the whole day today would be anything that has to do with your ears and anything that is considered as a problem with the auditory system. Problems with auditory system, what I mean is anything that has to do with your balance system, and I'll break it down, but anything that has to do with the field of audiology, which is my specialty. This is a little bit about me. I have a master's degree in addition to audiology degree. I have a bunch of certifications. I'm not going to bore you, but what I'm going to do is I'm going to age myself. I have had 25 years of practical experience now. So this is a little bit of the overview of what we're going to talk about today. Anything that has to do with audiological dysfunction as a result of a traumatic brain injury. And what I'm going to do is that I'm going to talk about the advancements. So I'm not going to talk about what was available 10 years ago, rather what is available now and where the future is going. So I don't need to tell you guys that TBI is one of the highest ratings of accidents and issues that happens, work related, I would say adults, pediatrics. So 1.7 million individuals in US are affected by it. And we are doing everything to hopefully decrease that number. But what is sad is that it's still up to 58% of people who are affected. They are not getting enough treatment for their audiological symptoms. And for that, I mean their hearing or balance or anything that has to do with that organ. Hearing dysfunctions are highly misunderstood and misdiagnosed. So I am hoping that by going back to presenting to you guys become my ambassadors and start talking to everybody else about all these issues. So TBI pretty much has a signs, and one of the things is that still, believe it or not, in schools even, or even some GP doctors, general practitioners, are not very familiar with the signs. So if somebody falls, like let's say a child falls off of a playground, they still don't know what what are they supposed to do. So one of the things that I want to inform everybody about the signs to look for, and one of them is that if that person who takes the fall, it's even out for about 5 seconds. So just the fact that they temporarily go out and come back, that is one of the signs of a mild traumatic brain injury. If they don't have any recollection of how did you fall, what happened, or you know what, who took you right after, who touched you right after. So the memory of the circumstances and a few minutes after, that is another sign. If there is any change in their mood or behavior, they are mad, sad, they start crying, they become emotional, belligerent, all of those are another signs. If there is any type of a neurological issues, you see like people shaking, their blurry vision, or they are trying to talk and the words are not coming out, or you're talking to them, they're not hearing you or understanding you, that's another sign. Nausea and vomiting is one of the signs that we all know, and that goes back to like one of the very early signs, first signs. And then anything that has to do with fatigue, lethargy, they want to tie, they're tired. Don't touch to me, don't talk to me. So I want to go to sleep. All of these things are signs which I want you to be aware and make everybody else aware of it. One of the things that I want everybody to know is that traumatic brain injury has to do with anything that touches your head or the head touching anything. So if a person hits their head to the corner of the table, I want that person to be considered for a TBI. If there is a ball hitting a person, as you see, a baseball, could be a MTBI. If the person falls from height, that's another one. If there is a car crash and the person goes like gets jolted, that's another thing. So anything that comes into contact, I would call a mild TBI. Please have it assessed. One of the reasons that we talk about everything in the beginning, when we were talking about TBI about 10 years ago, we were talking about like big things, MRI shows and all these things. But now it's not about that anymore. Even if the MRI doesn't show, even if the person does not like doesn't have a big gash, they're not bleeding, there still might be an MTBI, a mild TBI. One of the things that I would give you the example is our veterans which came back from Afghanistan. Uh, they all have a traumatic brain injury. Why? Because all these blast exposures, the louder things that blew up right in front of them, actually caused the jolt in the skull, caused the jolt of the brain in the skull, which we know that is what causes a traumatic brain injury based on the damages that causes, which I'm not going to bore you with what type of damages they are, but they are important and we want to address them. Again, I want to go back into signs and symptoms of a TBI. This is for just your knowledge, and I want you guys to become ambassadors and talk to everybody about all these things. We reviewed some of these things: the blurry vision, they cannot think clearly, they're irritable, mad, angry. There is unexplained sadness, they start crying, or they go into a depressive mood disorder. Emotional up and down, that's another sign. You know what? They are up one day, somebody says one thing and they start crying. Or they're up 1 minute and mad the next minute. So dramatic changes in sleep pattern is another one, especially falling asleep, concentration problems, and troubles with balance, hearing, or understanding. And I'm going to get into more details about all of these things. So, when we talk about the audiological problems because of a TBI, we are talking about anything that affects the brain, anything that affects your ears, and anything that affects the processing of the information. So here is a breakdown of what you see. So auditory system, it has a cochlea, which is the organ of hearing, and it has a vestibular system, which is the organ of balance. And these two are a part of the same organ, which we call it organ of hearing and balance. Cochlea is responsible for us hearing. So the ears, the external ears right now, when you guys are all listening to me, my sound is going into your ear canal, past the eardrum. It goes through the little bones and it gets into the inner ear where the voice, the waves of my voice gets translated into chemical signals that goes up to the brain for interpretation. So the job of the ears simply is to gather the information and to change it to a signal that is important for the brain to process. Vestibular system does the same thing. The information comes in from three different places: from our eyes, from our inner ear, and from our legs. And then the vestibular system changes this whole thing to a chemical information that goes up to the brain for interpretation. So this is why, if God forbid there is a damage to the brain, we can see damages to both auditory and the vestibular system. So the damages that we are talking about, the signs could be tinnitus, which I'm going to break it down, hearing loss, balance disorders, a person who cannot tolerate sound, a person who easily get angry and mad by hearing sound, a person who feels as if they are, as if they're on a boat. They don't have necessarily vertigo attacks, but they feel like they're unsteady. Anytime that they go down or lift up to pick up something, they feel like they are nauseated and they get motion sickness in the car very easy. So balance organ is very, very complicated. And as I told you, is the information that comes from the vision, from the vestibular system, and from our legs all the way to the brain for interpretation. And if the brain is not capable of putting all of these things together, then that's when there is a balance disorder, or which comes up with vertigo attacks, motion sickness, and all of those. Now, the newest technology that we are using in treatment, so this is where we go with like, okay, what are we doing? So we all used to treat everything in person. One of the things that exploded with COVID, and something good came out of it, was development of AI, digital reality, remote therapies, and this is the biggest thing that is happening in the world of vestibular treatments. So if the patient has any sort of a problem, now what we're seeing, there was a time that we used to yank the patient out of home. Let's go, come on, let's go to the office. And we used to actually have the patient sitting in front of us. And now we're not doing that anymore. There are patients who still come in, and still I would say one-on-one is the best way to treat the patients. But now that's not a necessary anymore. Now we are, doing this the same thing as we are doing over the Zoom. We are, I will do this, you do the same thing in your place. Or I do this and put your hand over my hand. So that type of a remote telehealth vestibular system treatments are available. Digital AI has improved so much that now we're using actually virtual reality in treatment. So there are equipment that we send to the patient home. There's like a cap that the patient's on. There's sometimes goggles that the patient on, depending on what we're trying to do. And sometimes there's a glove. I'm sure that you guys all remember Nintendos, and playing stuff with Nintendo. This basically resembles that now we can remotely, and even without me sitting in front of the patient, we can actually help the patient to do all the treatments in a way that we have designed for them. And most of them now there is in a way that they can actually get the artificial intelligence that the rehabilitation program gets changed based on, so I mean by change, I mean it gets easier or harder based on how the person is improving. If the person is trying to do something and they keep on not reaching the goal, the treatment gets easier. And then once they learn that, the treatment gets harder. So the sky is the limit with this. We are teaching through all these digital AI and the virtual reality, all sort of balanced treatment, something as simple as repositioning of the crystals that we used to do it in our office, to something very complicated as close your eyes and stand on one of your feet rather than both of them. The next thing that is happening, let's talk about the auditory dysfunctions. Auditory dysfunctions, remember, hearing loss, ringing in the ears. They cannot understand what they are told. They don't remember what they are told. All of these things are the auditory dysfunctions, which has to do with cochlea and how the cochlear system is functioning. So the best of the things that I have to do, I'm going to start with tinnitus because this is the biggest changes that we have seen after the AI and the virtual reality. I want to review what tinnitus is for those who are not sure of. So it's any sound that is heard in quiet when there is no external sounds, environmental sound available. That is called a tinnitus in medical terms. There are different ways that people describe the sound that they hear. Some they say, so if you see here, some say it's a ring, some say it's a white noise, some say it sounds like ocean. There are people who sounds like a shrill. So anybody describes it differently. So I would say when we talk to our patients, one of the things that we want to know is that, do you hear anything when the room is quiet? Do you hear anything that nobody else hears? So those are the ones that we call. And there are times that people say, you know what, I hear this river flowing. And for traumatic brain injury, that is what we call a tinnitus too. But depending on what the damage was, it could be a pulsatile tinnitus, which goes with their heartbeat, or it just could be actually they are hearing their blood flow in their head. So with tinnitus, what I want everybody to be aware of, again, remember the goal is that you guys are my ambassadors. You're gonna go talk to somebody else about it. What I want everybody to know about tinnitus is that if it is one-sided, that's not a good sign, and have it evaluated. So the treatments that we used to have, they used to be all simple treatments. You know what? Hearing aid, or you know what? Listen to music, or you know what? Put masking sound noise on. But now things are getting really, really detailed. We are getting psychologists involved in it by cognitive behavior therapy. There are a ton of treatments which are available based on psychological factors, but then we add behavioral changes to it. There are tons of treatments available based on even diet changes, lifestyle changes. We have a ton of changes based on instrumentation, and we have changes based on simply lifestyle, which I'm going to actually take you through all of these things. One of the most important ones, so these are some of them, some of the names of the devices that we have available and the treatments that we have available. Cognitive behavior therapy. So I want to tell you this. If I want to put it in categories, I will put the treatment options that are available in as ones which has to do with the behavior of a person. Things that we give instruments for, technology for, and things that we use as simple old-fashioned ways of treatment. So cognitive behavioral therapy, TRT, PTM, these are all names which based on, you know what, who the provider is. Most of the audiologists who are tinnitus specialists are supposed to know these things. There are nightly treatment devices. One of them is a Levo system. The other one is called a sleep pillow. Those both of them are amazing and they really, really work. We have sound machines now that it's for treatment of tinnitus. So I'm gonna actually take you through a few of these, which are the latest and the brightest is linear. It's the first of its kind, and as you can see this lady, not only we are using the sound input, rather we are using the tongue in order to help us to treat the problem that we are facing. So Neuromod is the mother company who is making this device linear. This is the latest release from FDA. And their FDA, now there's a difference between FDA clearance and FDA approval. This is the first device which is considered as a medical device, and it has a completely FDA approval. They have a new technology in a way that their FDA category is called de novo, means it's the first of its kind. It has not existed ever before. So we are taking advantage of the head and the headphone and the input to the auditory system, the sound, in addition to the tongue tip, which has electrodes, and it delivers so tiny butterfly frequencies into the tongue and trigeminal nerve. And basically, we are using both sound and the trigeminal acoustic electrical stimulations in order to change the tinnitus perception in the brain. This device is, again, one of the kind, not only because it's taking advantage of two sensory organs, rather because it works for all kinds of tinnitus. All the other devices that we used to have always worked for if it's a pulsatile tinnitus, if it's tinnitus at night, they had special categories. This is the first one that works for all kind of tinnitus. So it's a neuromodulation, which means it basically works with the nerves. This N needed to be up there. I don't know how come this slides have become so big. And then the second important thing is it's specialized for each patient. That means it's not a device that every patient gets the same thing. Yes, the electronic parts looks the same, but the programming that we offer for the patient, it's based on the information that we get by evaluation of the patient. So the treatment device of one patient cannot be used for the next patient because the programming of it is different. And it is programmable based on the computer software that we all use in our offices. And again, this device is based and centered on the tinnitus, the type of the tinnitus that the patient has. This device gets used twice a day. There is no one location to use it. It doesn't one way to use it. The patient can be lying down, can be sitting, can be reading a book. It can, as far as we use it twice a day for 30 minutes, we actually start seeing results in the way that the patient hears their tinnitus or the annoyance that the tinnitus was causing the patient. Again, remember the most important thing about this device is that the program is based on the patient, and what we say it's modifiable in the loudness and in the presentation of the tongue electrode. This is the safest device yet on the market. We have not since it got introduced in Europe about 7 years ago, but they got their FDA approval about 2 to 3 years ago now. We have had zero adverse negative reaction. There is nobody who has been saying, like, I use this and I have an issue. And the success rate of it is unheard of. It's 83%. So this is why it's talk of the town right now and everybody wants is after it. The next thing I want to talk about is hearing loss. This is a funny thing here. It says she's mad because she found out 1 in 3 people have hearing loss, so she doesn't feel special anymore. And research shows that one in 3 people who have hearing loss usually wait between 5 to 7 years before doing anything about it. But in our patients who have traumatic brain injury, we do not have that luxury. We cannot wait. The faster we start treatment, the faster results we get. Because we don't want the brain to learn maladaptive behavior, to learn bad things or doing things wrong. So I would give you an example of why we do this. Think about somebody has a broken hand and it doesn't get fixed, so the bones all get healed the wrong way. So we want to do the same thing. We don't want to give a brain a chance to heal the wrong way. The hearing, one thing that I want to talk about it's just the most important factor. It's who can treat hearing loss. Because in recent years, as the technology is improving and as the remote treatments are improving, there are a lot of people who are showing up online pretending that they have degrees. There are a lot of people who are selling hearing aids online, offering treatments online and remote. But what it's becoming the most important thing is the relationship and the knowledge of the person who is offering this treatment. I want to make sure everybody is aware of. But when a person has a traumatic brain injury, that means they cannot use, let's say, Costco hearing aids. It's not a very good idea. If a patient has a traumatic brain injury, they should not just be seen by a hearing aid dispenser. They should not only be seen by their general practitioner giving the, hey, these are hearing aids, go put them on. So we want to make sure that everybody realizes that people with even mild traumatic brain injury, they have a specific needs that needs to be addressed by doctors of audiology. Not even audiologists who are not specialists, not even the audiologists who don't have the AUD, which is a doctoral program. The reason for all of these things that I'm telling you, it's the fact that hearing loss and even mild traumatic brain injuries are correlated with cognitive decline and chances of development of Alzheimer's disease. So we want to make sure that the patient gets treated to the best of our knowledge that we have at that point. So, one of the things that we can talk about is assistive solutions, we call them. Assistive solutions are pretty much anything that you can think of available like an app or like a device that is not considered as a medical device. It's a device that is easily accessible to everybody. Some of them are available by Amazon, I would say. Some of them are available in Costco. Some of them are available by just making a phone call to the company which represents them. But these are the devices which we call non-medical devices. And one of the latest one, which is the top of the line, it's called AuraCast. AuraCast, it's coming out and hopefully, you know what, they just started presenting it to us so we can start presenting it to you guys, is basically the availability of a hearing. So you think about you put an AirPod on or you put an headphone on, and this headphone can connect to every social announcement or the TV in the gym or even my personal cell phone if I give you access to it. So pretty much this is what is giving all of us intercommunication between each other by just the availability of the AuraCast. So one of the most important ones that I'm looking forward to the AuraCast, it's all of us when we travel, we are having a hard time hearing the announcements of the gates in the airports and in the bus stations and all. I am hoping they will get to the point that they announce it over the AuraCast and we are using a headphone, it comes directly to us. I really am hoping that we get to that day. Hopefully very soon. Captioned phones are becoming very automatic. About 5, 7 years ago, it was very difficult to use them because they usually were delayed, jet lag, awful, misspelling, mispronunciation, all that. Now they're becoming so good that the captioning can get in time. So we do have apps that we offer to our patients. And when the patient goes to a doctor's office, the patient would tell the doctor, hey, I have this on. And pretty much you just put your phone on the table. The doctor is talking to you. Your phone is transcribing it. And at the end, not only you have the transcription, you can email it to your daughter who lives in a different state so that daughter could know what's going on. What happened during that visit? So it's a great improvement. We have devices that are recording. You know what? One of the best examples is the Zoom that we are doing today. The Zoom's transcription as I'm talking to you, it's going. So that's a great example of an assistive solution. So telecoil, FM systems, these are all old-fashioned way that we used to do it, which I still kept on this list because we are still using them and they are highly useful for our patients. But I would say most of the stuff that I'm using in my practice in order to bring relief to the patient and their communication, not only with their doctors and their therapists, rather than with their friends, is through most of the apps and the technology that we are using. I have a picture of a few of these assisted devices. I have an old-fashioned phone, which is, as you can see on the right side. The new ones don't look like that, but I wanted to actually put an old-fashioned because some of them are keeping the old-fashioned shape, but with the new technology. So I wanted you guys to know about this. TV ears is the one which is to the left side, and it's a direct digital input from TV or computer system via Bluetooth to the person's to the person's ears and their hearing aids if you want. So we are using a lot of assisted devices. Hearing technology are pretty much all sorts of what we put in the category of they help us hear, but medical help. So things that you cannot find in Costco, things that you cannot find online, things that you find in your medical provider offices if they know what they are doing and they actually have relationship with that specific manufacturer. One of the most interesting ones that I want to tell you are about glasses that actually now they transcribe under the edge and the person can read what the other person is saying, or glasses that actually they have directional technology. You are using glasses, but there's a hearing aid in there, and through vibration of bone you are hearing the person you're talking to much easier. So that one, the glass hearing aids are the ones which I am very much excited about, because we used to have glasses hearing aids, but this new technology combines again the visual and the auditory system. So the wave of the future is combination of inputs. This is what is very exciting and we see happening. So these are the names of a few of the devices that I have wrote because I just want you to have the knowledge, but I'm going to go through a few of them which have the bigger changes. One of the biggest one, which again, I personally love for my patients, especially my traumatic brain injury, is a hearing aid which is called Lyric. So this is a hearing aid. As you can see, is that tiny little thing in the patient's ear. It is not exposed to outside. It sits 3 millimeters away from the eardrum. An audiologist puts it in. It's a continuous hearing. Pretty much, it's a device that gives the hearing of the patient back to the way it used to be before the brain injury or before the head injury. So this is continuous, uninterrupted hearing and normal hearing. That's the way it is. I don't turn my ears off and I go to sleep. I don't turn my ears down when I am listening to or I'm in a restaurant. I am hearing all the background noise and I'm listening to the friend who I'm having lunch with. So this Lyric is one of the highest devices on my category because it brings normal, functional, daily life back to the person who has experienced a trauma. The next one are advances in hearing aids, what we call daily hearing aids. So Lyric has made the category of its own by continuous wear. And one thing that I want to say is that this device sits in place again 1.5 to 3 months. The patient sleeps with it, eats with it, takes showers with it. So we do not take it out. Think about dentures the way we used to have, which hearing aids are still dentures. But then now we have implants. You don't see anybody to take their dental implants out. So this is what Lyric is, but it's not implanted. We actually do take it out. And there is no surgery involved with that. But with implant, there is a simple surgery involved. So these are all different shapes of hearing aids that we have available right now. We have custom ones, which they are to the left. And as you can see, they are pretty much, we make this to the shape of the person's hearing, ear canal. So it sits in place. If we want to make it fashionably hideable, we make it fashionably hideable. If we want to make it big so it sounds like a personalized earphone or earbud, we can do that. There are the old-fashioned shape which sits behind the ear for the patients who are not comfortable or they have a skin issue that they cannot put anything in their ears. And the most recent technology that we see is regardless of which brand of hearing aids we are using, most all of them do have rechargeable batteries. So rechargeable batteries is basically what we do with our phone, with our cell phones. You plug it in, you use it, the battery goes down, you plug it in, it gets recharged. So hearing aids are all coming with that. Most the brands do. We do not use it for every patient, but in most of our patients we use it. Um, most of the devices have great use for a full day, so it does not run out of the battery before the full day is over. They are designed for the patient to put them on early in the morning and then put it for recharge late at night. So most of them now, the technology has advanced enough that the battery does not die in the middle of the day. Again, artificial intelligence and our hearing aids have become the most important thing, especially for our patients who have memory loss, balance problems, because the sky has become a limit with this type of hearing aid, and this is available specifically with one manufacturer only, which is American made. It's an American based company. The artificial intelligence with this Edge AI has the capability of reminding the patient to take medication, reminding the patient to pick up their children. If there is any announcement on their calendar, it comes into their ears. I am going to tell you guys that actually I use one of these, not that I have a hearing loss, but because I just the artificial intelligence of it, the connectivity to everything is so wonderful that even normal people are using it because it just gives us that edge. When it says give yourself an edge, this really does give an edge. And I will give you one example of mine. The reason that I use it is that I can answer the phone when my children are home without my patient seeing my phone come out of my hand, my desk. So I can actually touch the thing and I take phone calls if my children are calling. And you can see that they're compatible with iWatches, which a lot of Apple Watches right now have definitely all those apps that we are using for our patients to help them in their whole modification for their lifestyle. Central auditory processing and what the brain does with what we hear. So it's not only do we hear or not, do we hear accurately or not, rather it is what do we do with what we hear? Do we remember it? Can we tell in different words what we heard? Can we answer questions about what we heard? So in the central auditory processing, what the improvements that has become, one of them, again, is the use of the AI in the hearing aid technology that we use. We're not using the hearing aids for hearing loss, rather for all the advantages they offer to the patient who has auditory processing problems. I will give you one example is hearing in the background of noise. Most of our patients who have a traumatic brain injury, even very, very mild, or most of our children who unfortunately have a mild TBI, they do have significant difficulty with understanding speech when they are in a noisy environment, when they're in a restaurant, in a social setting with their families, when they're in weddings, in meetings. And we use the AI, the hearing aid again, this hearing aid for the help with the central auditory processing disorder. Again, the newest advantages that we have is it's not only AI that is used with the hearing aids, it's AIs that are used with oral rehabilitation. So the way that I want everybody to understand is that we had physical therapy for our body and broken bones. Now we have a physical therapy for our ears, which they're called oral therapy, and it's a AU. So if you see ORAL, that's a oral as in language and mouth involved. When you see a URAL, that's oral, which has to do with your ears. So we are using all these treatments that basically have become in the form of apps or computer programs or remote things that we do with the patient. The patient is sitting at home, I'm sitting here, and the patient is going through it. She sees the same thing as I'm seeing, and we just do it remotely. The patient doesn't have to be in my office anymore. And I can take advantage of the AI and give them homework, a homework that I know if the patient keeps on doing it over and over, she gets better. And if they cannot achieve the goal, it gets easier. So they can actually, it becomes into broken down parts so the patient can actually achieve more and we can achieve results more. Uh, there are acoustic problems, which I put it in a category. There are still auditory problems, but there are problems that the person cannot tolerate sound, or the problem that the sound makes them mad, or they just don't want to communicate with people. So these are specific specialty treatments that are available for our patients. And we are again using technology as in artificial intelligence, AI, the noise reductions and all of those for these type of patients. And basically these type of our patients were the patients who we did not have much to offer them, and with all these AI treatments that is coming in and all the apps and all the stuff that we know of, now we actually have multiple things for them to try. So if they only bring their attention and their willingness to put up the work, now we can do things for them. So where is the future going, or where we already are? This, you know what, if you guys remember, you know what, I'm old now. I remember watching James Bond movies and he used to talk to his wrist, and you know what, we're doing all of those. Or he used to take phone call in his ears by touching something. We are doing all that. This is the future, but the future looks very bright. Looks very, very bright because we have artificial intelligence, which is enhancing whatever we researchers, us, are doing in person. We have all those developments of brain computer interfaces. We are understanding more because our technology is improving. And because our technology is improving, we are learning more about the brain. The science is growing much, much, much faster. The personalization is moving much, much, much faster. And again, what came out of COVID, which, you know what, one thing I'm grateful for, it's the teleaudiology. It's the remote availability of services to people who cannot come to our offices because of a distance, or they don't have the physical capability of coming. One more thing that I want to tell you about, and I'm going to wrap up so we can actually have questions, is American Tinnitus Association. This biggest gift to all of us used to exist. It's like, I think this year they just had their 50th birthday, but they are becoming more involved with people one on one. They are asking everybody to join their group, to volunteer, to donate financially, to get involved. So American Tinnitus Association is ATA. I have the pleasure of serving the ATA board as the new VP coming from, I believe, July. I have been serving with ATA for the past 6 years, so this will be my 7th year. I want all of you guys to talk about it. One of the most important things that ATA started offering is an 800 number, which is available to everybody, especially to those who have tinnitus, because tinnitus is one of those things that everybody, even doctors, say, go live with it. There's nothing to do. Don't even think about it. So now, even for those who cannot afford services, there is an 800 number available that they can call and they can talk to a person who is like me, a specialized person. I used to take calls on Wednesdays, but as I have become more busy with the practice and life, I gave up that position. But there are people like me who are as knowledgeable, as understanding, as involved in research who take the call and they actually do offer patients solutions based on the location that they are. So, what I want everybody to understand is that we have acoustic treatments, we have everything which is highly individual, you individualized to what you need, what the family needs, what the lifestyle and work of the patient needs, but you need a specialist. You cannot just listen to every Jack, Jane, and Mary. You need to get to people who understand what they are doing. Everything has become a multifaceted. If anybody tells you that I know everything A to Z, know that they do not know anything. Because I swear to God, we are getting to places in our research that I would say soon the right ear and the left ear specialty could become separated from each other. Because the more we get to learn about the brain, the more we get to do things, the more we learn, the more we know how much we do not know. One of the things that I want to talk about is which basically makes my view of auditory and traumatic brain injury different is the fact that a traumatic brain injury is not a one kind. It's not only in your ears, it's not only in your hands, it's in the brain, which is the master of our body. And it is very important that the treatments that you get needs to be based on you, needs to be dedicated to you. If you are getting the same treatment and the next person is getting, that is not specific. So I want all of you guys to consider specification of your treatments. These are the treatments that we do offer in our offices. I am lucky enough that I have a psychologist, I have a PT, I have an acupuncturist, people available in our office who take phone calls, who actually just like me concentrate on the patient. So I want you guys to consider any practice that you go, if that practice is multidisciplinary, is a great practice. A few last slides is that if you guys have any questions and you reach out to us, and by any chance I don't get a chance to answer, which I will do my best, my new student who I'm hoping at some point becomes my partner, Dr. Jake will answer your phone calls and questions. So do reach out. I just wanted you to, hey, it was a she who presented. How come there's a he who is answering? He is very knowledgeable. He's compassionate and caring. He will take your calls. This is me, and that's the phone number on our website. And I want you guys to know that we are here to serve you. And one of the best news that I can have for today that you guys can use is in combination in an effort with American Tinnitus Association, our office is proud to start a remote support group. A support group which is dedicated to the audiological support of anybody who has a traumatic brain injury. This just got approved yesterday and we actually put it into writing this morning. So I am very happy that you guys are the first group who is hearing this from me, and I look forward to this. And we'll start offering it to all the other the other TBI support groups, but you guys are the first to know. Now you guys can go and talk to everybody about it. So here it is. This is information again. If you want, email us, admin Hearing Loss Solution. Give us a phone call with your questions. Again, either I or Dr. Jake will try to get back to you. And here we go. I actually made it in time. Here we go, 12 o'clock. I'm open to questions. I'm going to stop sharing my slides so I can start seeing your faces and answer.